There are a lot of patients presenting with cracked teeth, getting more and more nowadays, so we should cover the topic of cracked teeth so that everybody can understand more about it. Hi everyone, I'm Elyssa. I'm a root canal specialist in Singapore, and today our topic will be on cracked teeth. So before we start, maybe I'll just introduce to you the anatomy of a tooth. The outer layer, which is the whitish, or actually it's transparent, is known as the enamel. The yellowish layer here will be known as the dentine, and right in the center is what we call the nerves and blood vessels. It is collectively known as the pulp. So what is a cracked tooth? Initially, when we have little lines on the tooth enamel, only at this layer, it's called craze lines. This is not a crack, and this is formed because chewing forces create all these microscopic enamel lines happening here, and they're very superficial and painless. There's no pain at all and no treatment is required at this stage. At stage 2, crack starts to form. So this line deepens and it goes downwards into the dentine, and this is due to repeated chewing concentrate stress at weak points, and the crack extends into the dentine. So some patients will get pain on biting, cold sensitivity that becomes more prominent over time. And in stage 3, crack propagation. The crack goes deeper. Sometimes there is also a horizontal component across the tooth, and the bacteria enters the pulp and triggers pulpal inflammation. This term basically means that the nerve is inflamed, there is more pain that is involved. Some patients will get sensitivity to warm stimuli, there's lingering pain and also spontaneous pain. So some patients, if you're not doing anything, sometimes all of a sudden you get a jolt of pain, wakes you from your sleep, it gives you a headache. That's because the crack has propagated deeper. And finally, let's go through the common causes of cracked teeth. So first, we have heavy biting forces. If you know you grind or clench your teeth, you are at very high risk of having cracked teeth. Not just one tooth, but multiple teeth over the years. So chewing hard food is also not great. So if you like to chew hard nuts, you're eating nuts as a snack, chewing up the whole packets day after day, chewing on ice cubes, soft bone, granola, or even hard sweets, you're prone to having cracks. It's just a matter of time. So patients who also have very large fillings, you imagine the teeth are structurally weak, they could fracture and develop new cracks under this unsupported structure. Then that's when you get cracks underneath these deep fillings. It's also kind of related to age, because as we grow older, the tooth structure is known to be more brittle and more prone to cracking or breaking down. There's also this thing that was reported in research papers, which is known as thermal cycling. So it's referring to the habit of eating hot and cold food in short periods of time. So an example would be, if I'm going to eat hot pot with hot soup, and next to me I have a cup of cold bubble tea, I keep alternating it, you can imagine your tooth structure keeps expanding and contracting, expanding and contracting. And it's common sense, because this will affect the structure of the tooth, and the concept is it will make the tooth more prone to cracking. However, there is no clear temperature of which you should take your food, and they don't have a specific duration to say, if I'm eating this within like 1 minute, it will cause a problem. There isn't such specific details, but this is the concept that was introduced in the literature, because when they surveyed patients, they said that they had the habit of thermocycling, eating hot and cold in very short periods of time. So this is something you might want to consider, especially if you're a fan of steamboat or bubble tea. So in terms of preventive strategies, there are 4 folds. First, you have to go for regular dental checkup. So if you do have any pain and the pain just starts, go for a checkup soon, because you don't want the pain to be so bad needing extensive treatment. If the crack is detected early, the treatment will be very simple and painless. So other things that you can do during your dental visit is, if your dentist notices that you have very high wear on your teeth, they might recommend doing night guards or splints. If you clench, it will serve as a protection layer in between your teeth and prevent cracks from happening. We also recommend to protect weak teeth. So if you have teeth with very large fillings, instead of waiting for them to fall off or crack underneath the fillings, your dentist might recommend doing crowns or onlays as part of preventive measures. And at the end of the day, if you know your habits the best, you're always chewing hard food, crunching on ice, change your habits and always go for bilateral chewing. That means you chew on both right and left. Some patients tend to prefer chewing on only one side, and you realize that side wears down really, really fast. And again, like what I mentioned, avoid rapid hot and cold cycling to avoid cracking your teeth. So how do you know if it's a cracked tooth? So this is how we go and diagnose a cracked tooth during a dental visit. Let me share with you more of what to expect during the diagnosis stage. It is especially important to see a dentist or root canal specialist to identify which tooth is causing the pain. A toothache can have other causes apart from a cracked tooth. So for a cracked tooth, when a patient says, hey, I feel that I have a cracked tooth, I'll always ask them, why do you think you have a cracked tooth and what is the pain that you have been experiencing? So when did the pain start? Was it because you bit on something hard? What's the character of pain? Is it sharp or shooting, dull and aching? And is the pain there all the time or when you bite? Is it sensitive to hot and cold? Is it localized to the right side, left side? Do you know whether it's the upper tooth, the lower tooth? These are very, very useful information that can help us to pinpoint the causative tooth. And also for the duration of the pain, take note of how long it lasts. If it lasts for just a few seconds, it's great, but if it lasts for minutes, hours, note that down and let us know. And any history of spontaneous pain, please let us know as well, because this will determine how it affects your treatment plan. And for chewing habits and risk factors, it will be good to know, because if you just have that one instance where you're unlucky, you bit on something hard, you have one cracked tooth, okay, let's treat it and move on. But if you do have chewing habits or risk factors that predispose you to multiple cracked teeth in the future, let us know, and we want to work on prevention, because I believe that one cracked tooth is enough. We won't want any future cracked tooth apart from the first one. So if you do have any previous dental treatment on that tooth, your dentist told you, hey, actually in the past you had a cracked tooth and this was done, let us know so that we can follow up. With better history, it makes life easier for us as dentists. So when my patients come, I always try a bite test. If they do have a cracked tooth, it's very characteristic for them to have a sharp pain on release. This is what we usually use. It's called a tooth sleuth, where they bite down. But most of the time, I find that patients do find it a little too hard. So I'll usually start off with something softer like a cotton roll so that it doesn't elicit so much pain. And then we use this thing called transillumination, where we put a light source there. And with a light source shining through the tooth, we can see that the crack blocks the transmission of the light. And this will highlight the direction of the crack and how long it goes. And in this case, it goes from one side to the other side, which shows that it's quite a bad crack. And for dye staining, sometimes the cracks are not very visible to the eye. So with cracks that are present over here, if we put some dye, the organic debris picks up the dye, and we can actually highlight the crack, and this is very good for dentists to visualize where the crack is, and it's also great for us to take photos to show the patients. We will also run tests such as a pulp test. We'll place something cold, or an electric test to check whether the nerve is alive. If the nerve is not alive, you'll need a root canal treatment, but if the nerve is alive, we'll try our best to avoid root canal treatment if possible. I will also check your gum health by using a gum ruler. This will tell us whether there's any bone loss because of the crack or any damage done to the gums because the crack has worsened to that level. So we do take radiographs also. They come in the form of mostly 2D x-rays. These are used to assess for bone loss associated with the crack, any infection caused by the crack, or any causes of pain. I had an instance where a patient told me, I was told I had a crack. I'm very certain I have a crack and I need to do this. But after taking x-rays, we realized that it wasn't a crack, it was just a decay on another tooth. So that the problem was solved just by a simple filling instead of going through extensive treatment for what we think is a cracked tooth. So in this case, x-rays are really important. For this case, another case, this is a picture that I'm showing here. We can see that this is the tooth. It's a very long tooth. There is some infection over here. On this x-ray, we don't see any cracks at all, but when you zoom in to this image here in the mouth, there is clearly one line that is running here, and this is a crack. So this is my point. Radiographs, we can't see cracks, but we are just picking up a lot of other information that could help us with our treatment plan. So what treatment do I need if I have a cracked tooth? Let me tell you more about it. So first, we need to splint the cracked tooth together. If there is a crack, you'd want the crack to worsen when you chew your food. Imagine the tooth is like that and it flexes a little bit every time you bite. The crack will deepen and eventually the tooth may split. So splinting the cracked tooth, in other words, is just hugging the pieces together to prevent it from worsening. So sometimes for temporary measure, we'll put a stainless steel band. It will hug around the tooth quite nicely, but it's temporary because it's not custom fit for your tooth, and sometimes some patients might feel that the edges are a little bit sharp. For a permanent measure, if it's possible, we will recommend for you to go for a crown. This is custom fit for your tooth. It's very comfortable and just feels like your natural tooth. Best way to protect the tooth, because you not only wrap around the tooth circumferentially, there is also a helmet to cover on the top. So it covers way more surface area compared to just a molar band. So the second thing we have to look at when treating a cracked tooth is the health of the nerve. This is a diagram showing healthy pulp reversible pulpitis, irreversible pulpitis, and pulp necrosis. I know the terms may sound a little bit difficult, but let me walk you through. They're quite simple to understand. So healthy nerve just means that you have no pain, normal response, the tooth is okay. Reversible pulpitis means that there's damage done to the nerve, but it can improve over time. So that's when we look back at our history. Do you have sensitivity to cold? How long does it last? This suggests you have mild inflammation. Things can get better without root canal treatment. For irreversible pulpitis, like the name suggests, it means that the damage done has been to a level that the root canal treatment is necessary. So over here, patients are going to get severe pain, spontaneous pain, and also sensitivity to warm stimuli, and that's when you know it's getting worse. Between these two, one of them causes symptoms, the other goes asymptomatic. That means it may happen even without having very bad pain. So I would say that the test as well as the pain history that you give are just an aid, but any point in time if we do find that it's not really falling right into the categories, then that's when we have to re-evaluate whether you need root canal treatment. And then finally, pulp necrosis is when there's no response to the test at all, the infection goes all the way deep into the root, and when we tap the tooth it hurts you a lot because the infection has gone right into the bone already. So in this case, when you come for a cracked tooth evaluation, we'll check which kind of situation your nerve is in. I would say not all cases require root canal treatment, because if we can save your nerve, that's the aim. We want to initiate treatment early such that we do not need root canal treatment for each case. So this one, you definitely don't need root canal treatment. This one, 70-80% of the time you do not need root canal treatment, but everything here onwards, you definitely need root canal treatment. So just to support what I had to say, these are some prominent research papers that have been published. So if a crack is found early enough and the tooth is only mildly inflamed, which is in the case of reversible pulpitis, it has been shown that 80% of the teeth covered with a crown remain healthy, but there's still a 20% chance that you might need root canal treatment. Well, the odds are in your favor, so 80% is a really great number to avoid root canal treatment. The point is, if you come early enough, the nerves are still healthy, that's when you can keep things simple with just a crown. And this is a local study by one of my colleagues. It's published in also a very reputable journal of endodontics, similar to the one on the top. 71% of these teeth that were crowned continued to have healthy nerves after 3 years. So this evidence clearly shows us that not all cases require root canal treatment. And this will be a case that I treated recently. The patient came in with this filling. You can see it's a little bit worn down, very large filling. This is a risk factor, and you can see some lines running here. These lines are not due to the anatomy, that means that they are not natural lines, they are crack lines. The patient was having very severe pain, and after removal of the filling, the nerves were also infected. We had to do root canal treatment. You can see when I place the dye there, the stain actually goes down all the way into the root. It's really quite deep. So what we did was we did root canal treatment. So this was the tooth, we filled it up and we placed a band around it, and this is how it looks like. So after that, the patient was pain-free. She was really happy with the treatment. So patients will also ask, if I don't want to do root canal or crown, can I extract the tooth? You're right, that is certainly an option, but it might not be the best option for you. So let me explain why. After extraction, you will have some problems. You solve one problem, but you have another problem. Problem that you're going to have is, if it happens to be a tooth towards the front, like a premolar, when you smile, there's going to be a gap. It's going to be an aesthetic issue. People are going to look at that gap when you smile. And when you remove these teeth, which are usually towards the back, like premolars and molars, your function will be compromised. You can no longer chew as well as before. And in some cases, if you are having a very high risk of grinding, clenching your teeth, the rest of your teeth will have to bear heavier loading because you're chewing on the other side. You're prone to future cracked teeth, and it doesn't mean that every single time you have a cracked tooth, you're going to extract it, because you're going to have one problem after the other. So in terms of replacement options, these are the possible options, but you definitely need a consult with your dentist to see whether they are even possible. Implants, bridge, denture, or just leaving it as an empty gap. All these options require a certain amount of commitment in terms of the number of visits, a certain cost to it, and they may or may not work. So for example, implant, after extracting a tooth, the site might not be necessarily suitable for an implant depending on how much bone is left. And in terms of a bridge, you may have to sacrifice the adjacent teeth to trim it slightly smaller, and for a denture, it's truly very uncomfortable. I haven't had a patient telling me that they want to do a denture instead of treating a cracked tooth. So what happens if I just bear with the pain and I leave the cracked tooth untreated? So this is what happens. So in this case, you can see this tooth was cracked and untreated for quite a while. An abscess has developed. Sometimes there's pus coming out from the side as well. And in this case, the crack was running across, the patient kept chewing and chewing and the tooth split into two. This is no longer a cracked tooth because it's not like a hairline crack. The pieces are splitting apart, they can be movable, and it goes all the way down into the root. This tooth is known as a split tooth. It is for extraction, it cannot be treated anymore. And then at the end of the day, if you have a crack that is very bad, sometimes the bone and gum will be lost because it cannot attach well, and with all the infection over there, you're going to have very bad bone loss. And with this bone loss, even after extraction, you may not have suitable bone to do an implant. So at the end of the day, the bone loss in that area is compromising the future implant site. That's why I say if you extract a cracked tooth, you may not be guaranteed to get an implant. Okay, so that's all I have to share for cracked teeth. And let me know if you have any questions and I can address it in another video. Thank you. Goodbye.